Hey, y'all.
What up, y'all? And welcome to the Birth Squad podcast. If you've been riding with the squad,
hey, fam.
And if you're new,
welcome to the squad.
We're your hosts, Dr. Ijama Kwandu and Dr. Kamisha Thomas, two licensed obstetricians and gynecologists, as well as best friends.
We use real stories to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope you love learning about our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. Please consult your healthcare provider for your specific care.
So to learn more about us and for more information, please visit our Instagram at The Birth Squad and our Twitter at _The Birth Squad.
Please keep in mind that the following episode may cover topics that could be triggering to some individuals. Listener discretion is advised.
Meet Jess. She's the next badass birth warrior who will share her story to help the squad navigate through the complex and inspiring journey of pregnancy, labor, birth, and motherhood.
In this episode, we are talking about a very common issue that many don't talk about: miscarriage. During the interview, you may notice some medical terms or jargon, but don't worry, we got you. We have included definitions and explanations in the episode description, so please listen up and enjoy her story. But please also be advised that this may be triggering to those who have had a miscarriage before or are struggling with infertility. Welcome to our next speaker this week. We have Jess. Thank you for coming.
Of course. Thanks for having me.
So Jess, can you tell us a little bit about yourself and your family dynamic?
Of course. I am 35 years old. I live in San Diego. I am married, and I'm a nurse out here. And we just had our first baby almost 5 months ago.
So what called you to pregnancy? Like, what made you decide I want to have kids?
I was called to pregnancy very last minute. I feel like I did that whole thing where I was 25 and I was like, I'll check in with myself at 30. I'm sure I'll be more prepared. And then 30 came around and I felt the exact same that I did at 25. So I was like, well, that's not really a surprise, but here we are. So I feel like it was kind of like my mother's generation was the first generation of women that were expected to work full time, but also uphold 100% of the domestic responsibilities, 100% of the childcare. So while I perceive my mom to have been like superhuman, incredible person, like growing up, I did not envy her. I didn't want to be that person. So for me, it was kind of like, well, she has to do this. She's the breadwinner. She's doing all the domestic stuff. So I was pretty certain, like 70% certain I did not want to have kids. I had a great network of friends, 2 wonderful dogs. I was happy being a dog mom, and I was pretty comfortable in my single life. But then meeting my husband, he is like an incredible, very hands-on person, and brought up almost immediately that he absolutely wanted to have kids. And the more time I spent with him, I surprisingly very easily warmed up to the idea, because I knew he would really be a teammate and a partner, which is something that would be completely different than what I was used to, but something that was imperative for me if I was going to sacrifice so much of my, individual life for that. It would have to be that. So if it wasn't him, it probably would have been no one.
Oh my gosh.
Yeah.
Is he in the background listening to this?
No, thank God. I don't want his head to explode. So
why don't you tell us about your first pregnancy? Like, tell us about that experience.
My first pregnancy did not end in a live birth. So my first pregnancy, my husband and I got married in September of 2021, and we started trying in August. So August, September, October, and then in November, we got pregnant. So when you're actively trying to conceive, 4 months feels like 4 years, but in reality, 4 months is actually pretty quick. And I've been, I was 34 at the time, been on birth control for like almost 20 years. So I'm like, we got to dust the cobwebs off this thing and see if it even knows what to do. So we were kind of pleasantly surprised that we got pregnant pretty quick. And then I had a very normal, benign pregnancy, like pregnancy tests darkening every couple of weeks. I waited to call my OB because I just had never been pregnant before. So I really wanted to make sure that this was legit. And then I called them. I made an appointment for 8 weeks out. And then we miscarried on New Year's Day at 7 weeks and 6 days.
Now, Jess brings up a good point. She said that she waited to see her doctor until she was past 8 weeks. So when exactly is the best time to see a provider when you find out you're pregnant? Is it immediately when the stick turns positive?
Absolutely not. When you find out you're pregnant, you should make an appointment, but I would try to schedule it around 7 to 10 weeks. Now, why would I say that? Well, it takes at least 5 weeks to even see anything in the uterus on ultrasound. And I'm talking about a vaginal ultrasound. Sorry, y'all.
Yeah, sorry, but the vaginal ultrasound is the best way to be able to see a pregnancy in the beginnings, and that's the only way we can really see it. So, as Kamisha just said, we want to see so that we can actually see the pregnancy, measure it, and determine if your due date is actually consistent with the first day of your last menstrual period. This is also known as your LMP. Now, did Jess do something wrong by not coming in sooner?
Of course not. As we mentioned in Brittany's story, miscarriage will occur in about 1 in 4 or 25% of pregnancies, and 80% will occur in the first trimester, most often due to a chromosome abnormality, meaning there is nothing you did to cause it or to prevent it.
That's right. It is not your fault. Again, a miscarriage is not your fault. Not having sex or exercising, or maybe you had that one drink because you didn't know you were pregnant, you are not at fault. Like Kamisha said, the most common cause of a miscarriage is a pregnancy with abnormal chromosomes. Therefore, it's not compatible with life. So now let's hear how Jess handled her miscarriage.
How did you figure out you were miscarrying? Like, what were your symptoms?
Right. So I had a very normal morning, had a good breakfast. I was super well hydrated, felt absolutely normal. Hadn't had any pregnancy symptoms really prior to that either. And then when we sat down for a minute, I started to have like some pretty severe cramping. Something was a little bit off, but I wasn't bleeding yet. So I was like, I don't know. If I'm not bleeding, maybe I'm okay. Maybe my uterus is growing. But then about 4 hours later, I did start bleeding like a significant amount. And it was not just blood. It looked like it was tissue or matter. So then we called the OB. And the OB was like, well, you have two choices. It's a Saturday. You can go to the emergency room and they can ultrasound you. But ultimately, that's not going to change the trajectory. Like if you are miscarrying, unfortunately, you're miscarrying regardless. Or you can wait until Monday and try to get snuck in to an appointment at your OB's office, and then they can help you out there. We just were like, you know what? My house is warm. It's a safe space for me. If this is going to happen regardless, I'd rather be at home. So we waited from Saturday evening until Monday late morning to kind of find out what was going on, which felt super long. You know, when you're living it, you're just like, oh, it's still only Sunday. It's only 1 p.m. It's only 2 p.m. And then they really did squeeze me in. They made every effort to get me in there super early. But by the time they ultrasounded me, I had lost so much of the pregnancy that there was literally nothing on ultrasound when they went to ultrasound me, which in retrospect, I know is better. And even in that moment when he and I are like, just like white, devastated, feeling like almost empty, you know, we still felt like that was the preferred outcome than seeing a baby without a heartbeat. Like we knew that that would have been more devastating. But it still makes you feel a little invalidated. Like, oh my God, did I like make this up? Was this ever real? How could there be nothing there? You know, so then you go home and you're just like processing all these things.
What was their advice moving forward? How did they manage it after you saw them?
There wasn't a whole lot to do, honestly, in my case. Well, they're checking my pregnancy hormone, the value, just to ensure like the pregnancy hormone should increase at certain intervals of the pregnancy. It should be going up and going up and going up. So at the end of the pregnancy, for where I was in the pregnancy at the time, and then they had me recheck it in 3 days to make sure it was declining, because if it wasn't, that could mean that there were retained products of conception, or that it could have been an ectopic pregnancy, something along those lines. Basically, they just let you know, this is a normal amount of bleeding. This is a concerning amount of bleeding. Contact us if you're here. But if not, unfortunately, you just need to ride it out and take care of like your emotional well-being as best you can.
So Jess discusses her symptoms, and I want to just take a moment to provide you all with some more insight. In general, the signs and symptoms of a miscarriage include abdominal cramping, like a period, with bleeding.
Ijama, can you have cramps and spotting and still have a normal pregnancy?
Absolutely. That lower abdominal cramping and spotting are one of the most common symptoms that people might experience in the first trimester, and it can be normal. Conversely, If you have no pregnancy symptoms like nausea, vomiting, or fatigue, that doesn't mean that you're not pregnant. You just happen to be one of those few lucky people who don't have the classic pregnancy symptoms, and that's okay.
Now, Jess talks about bleeding and cramping, then passing her pregnancy. But it's important to know that there are different types of miscarriage, and I'll explain that right now. So the first situation is called a missed miscarriage. This is when you don't have any symptoms, but the pregnancy stops growing. And this is diagnosed on ultrasound when we notice that there is no heartbeat. This is always an emotional and difficult situation for everyone involved and is one of the hardest things we manage as an OBGYN. The next situation is called a threatened miscarriage. This is when you have some bleeding and cramping, but the baby has a heartbeat, and when we check, your cervix is closed. Recent data has actually shown that giving vaginal progesterone can help in these situations. It's called the PROMISE and PRISM trial. We will link the article for you below. The next situation is called an inevitable miscarriage. In this situation, the baby may still have a heartbeat, but you're having cramps and bleeding, and your cervix is open. At this point, there's nothing we can do, and you likely will pass the pregnancy soon. The last situation is called a spontaneous miscarriage. This is when you are actively passing the pregnancy, and this is what happened to Jess.
Now, the next question is, how do we actually manage a miscarriage? Well, there are 3 options. Number 1, watch and wait, also known as expectant management. Many miscarriages will actually pass on their own, but it can take some time, and we don't know exactly when it will happen. But oftentimes when you give it several weeks, the pregnancy may pass on its own. The second option is called medical management. This is when we offer you medication called misoprostol that causes cramping so that your uterus can actually express the uterine contents out. Misoprostol can be placed orally in your cheeks or vaginally. Some people will experience cramping and then bleeding. Some might also notice some side effects like diarrhea or nausea and vomiting. Medical management is about 95% effective. The third option for treatment of a miscarriage is surgical management. This is often done as an office procedure or a same-day surgery at a hospital. This is up to 98% effective. Sometimes people who have taken the medication or have opted to do the watch and wait approach may also ultimately end up needing the surgical procedure.
I tell my patients that there is no one size fits all. You have to do what's best for you. Do you want it to be over immediately? Well, the most easily accessible option is usually in medical management. Do you want to be asleep? Then surgery is the best option for you, but it takes time to logistically schedule the procedure.
Now, you may be wondering, is it actually safe to wait? Absolutely. This is a reasonable option. But how long you wait is definitely a discussion between you and your medical provider.
One of the potential risks of watch and wait or medical management is a low risk for infection and heavy bleeding. So, what is considered heavy bleeding or too much bleeding?
We consider it to be heavy bleeding when you're actually soaking through a maxi pad every 30 minutes, or you're using 2 maxi pads in an hour and it has no signs of slowing down. In that situation, we recommend that you absolutely seek care. We also recommend that you seek care for signs and symptoms of infection, or if you have pain that's not really controlled with over-the-counter medication like ibuprofen or Tylenol. Okay, that was a lot of information. Let's get back to Jess's story.
What was your emotional state and how were you managing that? Because that's a very difficult situation to be in.
Yeah, it was. I'm more so the type of person to just kind of shove things backwards in the brain and down and deal with it when I'm like in a better headspace. But it was the darkest emotional time that I have absolutely ever had. It's just a deep feeling of emptiness. And then my husband and I, it was our first pregnancy. So obviously like 0 out of 10, didn't recommend. We were like, this is terrible. I don't know if we want to do this again. And we had intercourse the night before. It was New Year's Eve. I was like, I'm going to be big soon. You want to give this a go? So then I know that it's not correlated. But in our minds, we were like, oh my gosh, we had sex and then we lost the baby. So I was like, I don't like now sex is associated with that. Like this is all around so terrible. And because it was New Year's Day, we had spent the previous night talking about like my husband's resolution was to be a good dad. So then you're like, oh my God, all of this just made it so much worse. It felt like a terrible omen for the year. It's not that I just wanted this period of my life to get over with. I was like, let's wash this whole year out. Where's 2023? I am physically and emotionally done.
Again, we just want to reiterate that for a majority of miscarriages, there is nothing that you could have done to prevent it.
Exactly. It is not your fault. Exercising, having sex, nausea and vomiting, diet, etc. These things are not associated with pregnancy loss. All right, let's get back to Jess.
So what did you do to kind of help you manage that? You and DJ, what did you guys do to kind of help make it through that?
Some of the most helpful stuff, I had my boss at work. I had to text her on that Saturday because I was due to work on Monday, but I was going to be trying to get an appointment. And I was just upfront with her about what was happening with me. And she had said that she had had a similar experience. And she was like, I'm really sorry. I know how this feels. She took me off the schedule for the entire week, which is not going to be the case for every single person that opens up about their experience. But for me, I was at the stage where I could cry at the drop of a hat. The wind would blow in my face at the wrong time. And I was just melting again. So my husband was super, super supportive. And then the other way that I kind of got over it emotionally was okay, if this was an abnormal uterine pregnancy and it couldn't survive being in my safe, comfortable, warm little womb, then it probably wasn't meant to be in this world that has, there's so much that's been changing in the last few years. It's it's kind of a dark, devastating place to be in anyways. So if this baby wasn't meant to survive where it was at, it probably wasn't well enough for this world. We need a strong baby to survive all the things that we're going through as a family. And this baby wasn't meant to be, another one will be.
Mm-hmm. Do you feel like anybody, besides DJ and besides your boss, think anybody else kind of helped you through that? Or were there any other resources that you two used?
It was really just kind of coming to a place where I was more comfortable talking about it. I had mentioned to you before, when I finally did go back to work, everyone's like, oh, you finally got COVID. Everybody just assumed what had happened. And then it's okay, you don't really want to correct them because you don't want to go there. But eventually I was just you know what, I didn't actually, I had a miscarriage. That's why I was off. And everyone was like, oh my goodness. But you wouldn't believe how many people were like, oh my gosh, I had a miscarriage. I had a miscarriage with my first baby or between my first and second. My mom told me she had a miscarriage. I've known her for a really long time. It wasn't something that had ever come up previously. And I was like, it's just not something that people talked about. So many people since then have been like, oh my gosh, me too. So it just made me feel this is more when I see it at work, it seems like it's common, but to the woman who's experienced that, you feel super alone. You feel like there's something wrong with you when there's absolutely nothing wrong with you. That baby wasn't meant to be in this world for whatever reason. So for me, it was talking about it more, getting to a place where I could talk about it more. So I could, and it felt like I was helping other women, which was a good distraction from me feeling sorry for myself and what had happened to me, is because there were so many other people who had something similar happen. So I just feel like it was therapeutic for everyone involved to actually start that conversation. So once I was at that point to be able to do that, from then I've just kind of just kept talking about it, really, which is not going to work for everyone, but it really worked for me.
Jess brings up a key point. You are not alone. Once she opened up to others, they shared their experiences of their miscarriages as well.
Now, we're not saying that you have to share your experience because we understand that this is a very sensitive event, but we encourage you to find someone or something that can help you heal from the experience. This can be talking to your partner, a therapist, a friend, reading a blog about miscarriage, joining a support group or forum, or listening to our podcast, because the Birth Squad is always here for you. All right, now let's hear what Jess actually did after her miscarriage.
At what point in time did you guys feel like, okay, we're ready to embark on this journey again?
The answer is kind of funny. It was more so my husband's birthday was 3 weeks later, and we did not want sex to be associated with this devastating loss. So it was kind of on his birthday, we were should we get this over with? This sounds terrible. But it was I don't want to be scared or uncomfortable or have a weird pit in my stomach about having sex. We should want to have sex with each other. So we kind of had a sad, we had intercourse. It wasn't the best. It wasn't the absolute worst, but it definitely was not the best.
Yeah.
And we were but at least it's over with. And it kind of felt like a weight was lifted. All right, we are capable of having sex with each other and not obsessing over that one thing, and at least it's off. Like, I just felt like we had taken care of that thing, and it did honestly feel better because I was scared to do it. I was like, it just feels so odd now. And then we ended up conceiving in that moment. So like, your uterus is all primed and ready to go. So I was just bored, and I checked the pregnancy test a little bit after, like maybe 2 weeks later after we had miscarried, and I was still positive. And then I never got a period. So then like 2 weeks after that, I checked it again, and I was like, it's darker. Like, this is super weird. But it wasn't, I was like, is this the old pregnancy? Is this the new pregnancy? So we were super confused, but it kept getting darker. And then ultimately we made an appointment at the OB again. And it was only 8 weeks, like 8 weeks to the day after the miscarriage. And the baby had a healthy heartbeat on ultrasound already. So then in the office, just melting tears, him and I looked at him. I was like, shit, he's crying. I'm done. There we go. Excuse my French.
That's amazing. So then what's going through your mind? Like, you're like, shit, I'm pregnant again. I don't know if I was ready for this. Like, what are the emotions that you're feeling? What's going through your mind? How did you approach this second pregnancy?
I know that I didn't fully grieve the first pregnancy, but this is ultimately the best distraction you could ever ask for. With the previous pregnancy, we had downloaded an app to help us like see where the baby was at developmentally. Like, it's the size of a peppercorn. It's, this and that. So then became part of our morning routine. Every morning we would look and see what was going on with the baby developmentally that day. So then when you lose the pregnancy and you lose that part of your routine, it like kind of makes you feel sad. So we were able to kind of pick up, we just started over. So we remembered a lot of the processes until we surpassed 8 weeks. And then it was something new every day. So it was kind of a nice distraction. The only thing, and I think other women who have experienced loss and then experience life will say, like, normally you go to your ultrasounds and you look forward to like seeing how big the baby is, who do they look like, this and that. I think with every ultrasound, I experienced tremendous anxiety. Like, am I going to look up there and there's going to be nothing there again? So I feel like the things that most women who are pregnant, who haven't experienced loss, look forward to, women who have experienced loss do not have that experience. They have an extremely anxiety provoking experience where history has made them expect the worst in those moments instead of just being able to enjoy the process.
Do you ever get to a point where like deep breath, like we've made it? Do you ever feel like you experienced that, or you just always carried that sense of anxiety with you?
I want to say that I always did the whole time. Like, I had talked to DJ about how eventually I wanted to talk to you about my experience, how I wasn't even willing to do that until I had a healthy baby sitting in my lap. And even still, even now that we've gone through everything that we've went through and he's here, it still feels super surreal. But and even through the last ultrasounds, even through delivery, because there are so many things that can still go wrong at that point, it wasn't until I heard him make sound for the first time that I felt like everything was going to be okay. I want to say that was the moment. It wasn't the 20-week anatomy scan where he was developing appropriately, cardiac anatomy cleared. It wasn't at any of those points where it was being reinforced that he was healthy and fine. I'm hearing it, but I'm not believing it in my heart. I'm hearing it in my brain. My brain is logical, but my heart is like, there are so many things that can still go wrong. Things have gone wrong. So like, I know this. So it really wasn't until he was here that I could breathe any sigh of relief.
Wow. Pregnancy alone can be stressful and anxiety provoking. Now, Jess discusses this extra layer of emotions associated with it.
It is really important to give yourself grace. If you're listening to this and your partner, family, or friend is pregnant, please be kind and gentle. It is such a vulnerable time. Now, Jess is going to share her birth experience with us, but please be advised that this could be triggering for those who have experienced labor and birth. We recognize and understand the significance of birth trauma.
So you kind of briefly mentioned it, but do you mind telling us about your birth experience a little bit?
No, I don't mind. I am the type of person where I didn't really picture very much of it at all. I didn't really talk about it much at all because I'm anxious at baseline. The more I think about things, the more I'll spiral. So anybody who asked me, I was like, my goal is medicated vaginal. I'd love an epidural. I work with a bunch of the anesthesiologists at my job that might have been doing it. So I would joke around with them, if you're on that day, you making it double, okay? Because I'm not trying to feel anything. And then obviously I preferred vaginal, more straightforward, but like whatever the outcome is going to be the outcome. So I really didn't fear birth or anything like that. So at 6:30 in the morning I went off work at 38 weeks. So I had a week to kind of like relax, put my feet up. But by then I was bored and I was really uncomfortable. And at 39 weeks in a day, 6:30 a.m., my water broke. I woke up and I was like, is this just normal discharge? Because you got a lot of discharge in pregnancy, or is this show getting on the road? And then I went to get up and I was like, oh, holy show on the road. So I'm sitting on the toilet in our bedroom and I'm like, DJ, he sleeps like the dead. And then finally I was like, my water broke. And he shot out of bed like a black cat, almost hit his head on the ceiling. And then he's just cycloning around the house, burning croissants, stress packing things that we don't need. And I was like, this friggin' guy, I cannot. So I went and took a 45-minute shower. I'm not in any pain yet. I'm just like straight chilling. And he wanted to get to the hospital like yesterday. And I was kind of like dilly-dallying and taking my time because once we're there, we're there. So we got there a few hours later. I am kind of like when I talk on the phone, I pace around the room kind of person. So I thought I was going to want to be active during labor, birthing balls, hopping around. As soon as they started Pitocin, because I didn't progress for the first 4 hours I was there, they were like, we'll give you 4 hours. If you're not anywhere better by this time, we'll check your cervix. We are recommending that we get the show on the road a little bit because your membrane's ruptured at 6:30. So obviously we don't want them to be ruptured for too long before you deliver. So once they started Pitocin, I was so uncomfortable that I didn't even want to move. I expected to, but I really was like, every contraction makes me want to fall over into this bed and stay there. So let's get this epidural going, basically. So I called them, they came, and I had my first epidural. I let a fellow try, which was on my birth plan to not let a fellow try, just for me personally, my experience at teaching hospitals, and he missed. So it was like super painful, super uncomfortable. I was like crawling out of my skin. Then the attending got it, and I started to feel numb, but only on one side. So they had me flip over and lay with my awake side dependent. So the meds could kind of like flush towards it basically. And it just didn't work. It never got numb. So that was my second epidural. And they kept bolusing me with that side down, like really, really trying. They were working super hard to get me numb. And I just was wide awake on that side. So eventually overnight, the anesthesiologist on call was a good friend of ours. And she was like, I'm going to redo it. Like the time is coming. Like, let's just start over. I really didn't want to, because I was pretty uncomfortable from the first time. Cause they're kind of poking around in there, you get pretty sore. But I let her retry. And so I started to feel numb on both sides. And I was like incredibly relieved. I was like, oh my gosh, this is going to be so much easier to push now. This is what I wanted. This is what I pictured. And then the other leg, the numb leg, woke up full on, even more. I think the other one might've been more numb than I realized before, because now my opposite leg was wide awake. And it was just that moment where they were both numb. And there was nothing she could do. She's like, I don't know, man. So we did the same thing, other side dependent, tons of boluses. But ultimately during my labor, I could feel 100% of half of my vagina, which was not what I expected and not what I wanted. But it wasn't even in the realm of possibility for me mentally that could happen. But if it was, I would have freaked out the whole time. So it wouldn't have benefited me to know that my epidural couldn't work. But it didn't really work. I mean, half is better than nothing, but I could still feel so much more than I intended to feel. So that was interesting. And then we had some fetal distress. It was, he was really in distress. Like his heart rate was dropping into the 30s with every contraction, 30s to 40s. I actively pushed for 40 minutes, which I think for a first baby is like not a whole lot of time. I think it was like 41 minutes. But I feel like for every contraction, they were like, all right, you're going to push 3 times for 10 seconds long with each contraction. I was like, I'm going to push 4 or 5 times for 10 seconds long with each contraction, because every time his heart rate would go down, I'm brought back to the time where I lost the other baby. And I was like, I have suffered with this uncomfortable pregnancy for 9 months. There's a healthy baby inside me. He needs to come out, and he needs to come out safely. So I pushed like the Dickens, basically. I delivered 23 hours and 59 minutes after my water broke. And he came out completely blue. I don't know what his APGAR score was but he didn't make a sound for 60 seconds. So as far as on my birth plan, I wanted delayed cord clamping. I wanted my husband to cut the cord. My OB let him gown up and humored him, and then literally hip checked him out of the way, cut the cord, let him cut the cord, what was left of the cord, humored him later so he could have that experience. But then they were vigorously rubbing the baby, and my mom and her terrible videography skills captured it was a full 60 seconds where he was blue blue, and not a single sound. So we were just waiting, and he was moving and he was kind of propping himself up to look at me, but he wasn't making any noise. So they tried to put him on my chest, and then they took him right away until I could get him to look a little bit better, which took over a minute. So crazy.
You're not like, I can imagine what's going through your mind at that time. You're like, no, like
not now, not at the umpteenth hour. Like, this can't possibly be. But he was awake, like he was alert. He just wasn't making any noise, and he seemed to recognize my voice right away, which I think because of the miscarriage, I kind of, my mom's like, you need to sing to him more. You need to talk to him more. But I felt a little disconnected because I felt scared. If I'm going to bond with this baby by singing and talking to this baby, then the baby gets taken away from me. I'm not strong enough to handle that 2 times. But when he was born, just from me talking on the phone or talking to my husband, he propped up and looked right at me. As soon as I started talking, he was like very engaged, like, this voice I know, this person I know. And that made me feel relieved. Like, I might not know really what I'm doing being a mother, but this kid already knows who I am. And he's like, he knows me. So he's going to wake up and he's going to be here with me.
Good Lord, y'all. So much to unpack. Jess tells a story about delivering at a teaching institution. Now, as someone who works at a teaching institution, I will say that it is important for you to know if you're delivering at one. As a medical professional, I acknowledge that we all need to learn how to practice medicine. And as much as I wish it, we didn't come out of the womb knowing how to do our jobs, okay? However, if you do not want to have a doctor in training or a nurse in training as a part of your care, then that is your right. If your birth center or hospital tells you that a trainee is the only option, then you have a right to go somewhere else. We want you to feel comfortable with the care you receive.
100%. Now let's talk about Jess's epidural. Was Jess's situation common? Well, yes and no. Each person is different. There is variance in how our nerves travel through our body and variances in how we actually feel pain. So the amount of coverage that an epidural can provide may differ between individuals. But in general, an epidural should cover from your abdomen down to your toes. But in some cases, you might get what we call a hot spot, or an area with less anesthesia coverage. Many times, anesthesiologists will try to give you some extra medication to try to fix it. But in some cases, they might have to redo the whole thing.
I tell my patients that our nerves are like electricity. We are all wired differently, so your coverage will be different. Some may be completely numb, others may just have decreased sensation, but an awareness of the contractions.
But the most important thing to keep in mind is that the nerves that an epidural targets do not include your vagina specifically. Many patients may say that they actually feel what we call the ring of fire, which is basically when the head is crowning, and this is normal. Actually, it's helpful to give you feedback so that you know if you're pushing in the right place.
Okay, now let's talk about the delivery itself. If you are close to delivery and the baby has fetal heart rate decelerations, we will try to deliver you as quickly as possible. This is something we talked about in Samantha's episode.
In general, most first-time moms will push for about 2 to 4 hours. I know that sounds crazy, y'all, but that is normal. If the baby is in distress, then we may offer you some help to help pull the baby out. This could be done with a vacuum or forceps.
Fortunately, Jess didn't need that, but the baby was blue.
At most hospitals, we do what's called delayed cord clamping. But if the baby doesn't gain color, doesn't cry, or doesn't move when it's being stimulated, then the pediatricians or the baby nurses may take the baby and provide it with more support as it's transitioning. This is what happened to Jess.
Yes, but at the end of the day, everything was okay. Very traumatic in the moment, but most babies will recover immediately.
Now, the last thing we wanted to touch on, Jess mentioned that she delivered 23 hours and 59 minutes after she broke her water. So why did the hospital start Pitocin at around 6 hours?
Well, as we mentioned in Oni's story, episode 3, prolonged rupture of membranes can lead to infection. I usually tell my patients that if you haven't started contracting after about 6 hours, then you may need us to help jumpstart your labor. We will include an article on recent data discussing prolonged rupture of membranes and the risks associated with it.
Ooh-wee. That was a lot. Now let's let Jess finish her story.
What do you feel like when you look back on your experience? What do you think were the biggest challenges that you experienced, pregnancy, postpartum, and also with the things that like surprised you?
I had a pretty benign pregnancy. I was super lucky. I had lots of heartburn, and the urban legend is your baby's going to have a lot of hair, and he looked like he had a toupee on, so that checked out. I had carpal tunnel really bad in both wrists, starting at like 34 weeks pregnant, which I'm sure I'd heard of being a thing at some point, but it's not terribly common. So that was kind of a weird surprise. Otherwise, I had some itching, but my pregnancy was pretty easy. Like I had barely any morning sickness the first couple of weeks. I'd have like a saltine in the morning. It would get me through the whole day. And I didn't really get uncomfortable until week like 36 or 37, because I was working full-time or overtime as a nurse, grinding until the very end. So pregnancy was really easy. In my postpartum period, I had a lot of health complications. My only medical history is ulcerative colitis. So I was tremendously sick and had a really hard time taking care of the baby, because every 3 weeks I was kind of down for the count. I was so dehydrated for so much of the early postpartum period that breastfeeding was not the easiest. Like I could chug as much water as I could try to, but I think just being so sick gave me some supply issues, which ultimately led me to have to supplement with formula earlier than I intended to. There's nothing you can do about it really. So that was a bit of a challenge, but I healed. I feel like I healed pretty well. And then within 4 weeks, I am like back to my normal self. And then you just get into the flow of it. You're so tired in the first couple of weeks, you kind of forget some of the challenges. And then you wake up around 4 to 6 weeks and you're like, oh, like I feel a little bit more human. And now, I'm figuring out what I'm doing with the baby.
Nice. Do you feel like there's anything about your experience that you're still processing, like you're talking about like, oh, I woke up at 4 weeks, 6 weeks. Do you think there's anything else that you're processing throughout your whole pregnancy, or you wrote your blog, were you able to help process part of, that miscarriage and this pregnancy through that?
I think so. I feel like you constantly relive the experience, the good and the bad stuff. I feel like in the beginning I was like hyper fixated on, he was blue and this and the heartbeat dropping. Like these are things that kind of circled through my mind a lot in the first weeks. And now that he's happy and healthy, I'm so distracted by all these developmental milestones. So the stuff that like kind of mattered and was traumatizing from before, you're really too busy to focus on now a bit. It's not that I don't reflect on it here and there, but there are just so many things. So my hands are too full to really be thinking about that stuff. So I wouldn't say at this point, I'm like almost 5 months postpartum, there's a whole lot that I delve on about the birth experience. It was just such a whirlwind. So in the beginning, you focus on the little details, but already it's so far from it that everything's a little more out of focus. And I just have such different priorities and I'm so busy. I don't reflect on it a whole lot anymore.
Is there anything you look back on with fondness?
Think about this moment when we were transferred and then they brought me breakfast and my husband was trying to fork me some scrambled eggs and we dropped the scrambled eggs on the baby's head and we both started dying laughing. And I was like, this kid is not going to be perfect. He's not going to have a perfect upbringing, but he is going to be surrounded by love and laughter. This is not the only time we're going to drop something on his head and he's just straight up sleeping. But I was like, it kind of was like, we needed that moment to just laugh and be like, he's here, he's safe. Everything's going to be okay. We're not going to mess this kid up because we're so well-intentioned and we'll wipe the eggs off his head and let's get going on this, let's get started.
That is great. Well, is there anything you would have changed, or questions you wish you would have asked?
I think for one, I am like a really good advocate for other people. And for some reason, even though I'm very outgoing, I'm a terrible self-advocate. And if you feel uncomfortable, whoever your partner is, because there's a lot of inequity in pregnancy, especially in heterosexual relationships. The woman is growing the child. She is birthing the child. She is dealing with the post-op complications, the breastfeeding. It's more emotionally and physically demanding on the woman. It's not a competition. Partner has to find a way to actively help you, whether it's something as simple as refilling your water bottle or hand delivering the birth plan for you because you feel uncomfortable. You're in too much physical pain and emotional distress to have to be your own advocate in those moments. So your partner really needs to step up, whether they're good with difficult conversations or confrontation or not. We talked about, if we're in this position again, you're handing off my birth plan, you're advocating for me to get a new nurse, we're calling the on-call doula, whatever it is to give me the resources that I need to feel comfortable. So I think I would say, show your birth plan. Don't be shy. You worked hard on it, and have your partner be your advocate. Like, they are there with you. There's only so many ways that they can help you. You're taking on the majority of the burden of this entire situation. So the least they could do is be your advocate in that moment.
Is there anything else you would just want to share with anybody who might be listening, might be thinking about getting pregnant, has had a miscarriage?
The biggest takeaway from me, it does women a tremendous disservice to project this narrative that pregnancy is really straightforward. Like, you have sex, you get pregnant, you have a baby, not everybody's timeline is the same as the next person. And it's not always easy to conceive. It's not always easy to maintain a pregnancy. I think that miscarriage has got this like shameful connotation where women don't really talk about it so much. But in talking about it, I've really helped a lot of people, and a lot of people have really helped me. So if you can't get pregnant the straightforward way, I have so many really close friends that are going to really great lengths to have a baby. So it really doesn't do women any favors for people to broadcast like their experience was super easy. Because I think if they really look back and reflect, there were hiccups. There's no straightforward experiences. There's a lot of stress. So the destination can sometimes take a lot longer or not be as straightforward as you think. So I feel like, support other women, let them know that it's not always super easy, but if it's something that they want to do, keep at it, do whatever they feel comfortable with, and just, be open-minded and have these discussions. You don't have to outwardly talk about miscarriage if that's not something you're comfortable with, but, support women when they first get married. Don't ask them, when are you having babies? You just never know what they're struggling with. Or are you going to have another? Like, it's just, and people don't mean anything by it, but you just don't really know how much you could hurt somebody with these simple questions. And then the other part of it is not all issues with fertility are the woman's fault, So there's just so many factors. Be gentle when you ask, and, be supportive as best you can.
Thank you so much, Jess. This was amazing. Do you want to share with us how we can find you? Any other way you want people to interact with you?
A WordPress blog, and then I write for Collective World, which is the new thought catalog. I usually submit and have my stuff published through them so that more people can see it. So I hope to be writing more in the future.
Well, thank you so much. It was so great to talk to you. I knew a part of your story, but the other pieces were just really, really meaningful. So I really, really appreciate it.
Awesome. All right. Thank you guys so much.
Well, y'all, thank you for listening to the Birth Squad.
We're going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts.
Remember, as you navigate your healthcare journey, that you are beautiful, you are brilliant, and you are brave.
We at the Birth Squad would love to hear more from you. Tell us what topics you'd want to hear more about. Hit us up on Instagram at the Birth Squad, and on Twitter @_the Birth Squad. Most important, make sure to share this episode with your squad. Until next time, I'm Dr. Ijama Okwandu.
And I'm Dr. Kamisha Thomas. Peace, love, and solidarity from the Birth Squad.
Check out the podcast description for the explanations on some of the terms that were mentioned in the podcast. There, you can also find more information about Jess.